Well, good afternoon, everyone. I think we might be having a little bit of technical difficulties with one of our panelists, but I'd like to kick things off. Thank you for joining us this afternoon, where we're going to talk about healthcare, trends in investing, and particularly with a focus on post-COVID investing in healthcare services. My name is Sri Manny, and I'd like to take a moment for each of our panelists to introduce themselves. I'll be moderating today's panel. I'm with Goldman Sachs, and I'm in the Healthcare Investment Banking Division, where I focus on healthcare services companies, not-for-profit and for-profit healthcare companies that provide healthcare services both in a setting via technology, as well as the managed care services sector. With that, I'll hand it over to Tim to share his background and perspectives.
Hi, Tim Howe, and I'm with Cox Enterprises, and I work in our strategy and corporate development group. For those of you who aren't familiar with Cox, it's a privately held company, does about $21 billion in revenue. And it's actually pretty fascinating. Some of you might know it for the cable division that we have or automotive, but Cox is on a bit of a growth story and working on diversification. And so one of the areas that I lead is our healthcare diversification efforts. And so, look, my orientation to healthcare, I started professionally working in healthcare at GE. I had a 15-year career there. And I was actually turned off by sort of the misincentives that I saw in the US, not necessarily in the Middle East or China, where I also worked, but my opportunity to get back into healthcare with Cox, I saw a lot of opportunities in the realignment with value-based care happening in the industry. So happy to be back at it and working on some of the hard problems.
Kenneth, would you mind taking a moment to introduce yourself?
Certainly, thanks, Sri. Let me be the first, because it's 12:04 p.m. to say good afternoon to you all. My name is Kenneth Saffold. I'm a director in BlackRock's U.S. private credit team. Our team globally is a $25 billion assets under management credit-focused investment group. Within the U.S., we make up about 50% of that, so $13 billion is all focused on U.S. Credit investing. We have two strategies. One is our direct lending strategy, where we're working with sponsors and management teams to provide M&A financing, as well as growth financing. And then we also have a special sits focus, where we are providing sub-debt, structured equity, and equity investments, as well as co-investments with our sponsor relationships. By way of background, I am from a team called Tannenbaum Capital Partners, which in 2018 we actually sold to BlackRock. We're a small 30-person firm where I led the Southeast for Tannenbaum Capital, and in this role now with BlackRock, I lead our Southeast focus. Prior to Tannenbaum Capital, I, like Tim, was also a GE Capital person. I was there for about a decade, focused on healthcare, leverage finance, and before that, Goldman Sachs.
Great. Thank you guys for joining this afternoon. You know, as like all of you who are participating today, we're all living through a pandemic, COVID-19, which has fundamentally changed our businesses and our world in which we operate since March. And I'd like our panelists to share how COVID has affected their investing thesis, where they're thinking capital is going to be deployed in the future, and any sort of prognostications they might have about how things might change as we emerge out of COVID. Maybe Tim, I'll ask you first.
Sure. So our orientation to investing, I mentioned that Cox is working on diversification, and so we've been entering the industry by making investments, to learn, to get additional conviction. And what it is doing is it's actually proving out some of our investment thesis, because as I mentioned before, we're looking at the opportunity for value-based care. And what you can see that's happened during COVID is certainly the fee-for-service sectors just really getting hit hard. Everything from elective procedures to people being able to visit their clinics that are more fee-for-service oriented. And so we've been taking a perspective on value-based care and also digital health. And what we've seen is just an acceleration of adoption for digital health tools and business models just there's greater conviction in the space, and I think it's also helped to educate a lot of the consumers, that might have not had the same awareness beforehand. So for us, it's actually an accelerant for the way that we're thinking about our investment thesis and the strategies we're pursuing.
Thank you, Tim. Kenneth, how about you?
Certainly, I think to answer your question, Sri, our investment thesis has, it's been significantly altered during the pandemic. This goes for healthcare, but also we're generalists at heart. So, probably all the sectors that we cover. I'll say that it's probably, and I'll take you kind of through a timeline, just given kind of where we are. And I'll start at Q1 when we initially kind of got into this work from home pandemic quarantine. And, initially in March, March 13th, when we decided to come home, the capital markets were frozen completely. Deals weren't getting done. And as a result, there was obviously not an opportunity to invest in new deals. So we were kind of at a standstill as a firm, or as a group rather, on our private credit side. We at that point looked to the secondary market, typically less liquid, but an opportunity for us to pick up some yield. Transactions were trading off kind of 90, 85, even lower, 80 cents on the dollar. So that's where a lot of our activity was initially at the start of the pandemic. I'd say moving into kind of Q2 and even some into Q3, we certainly started to see a loosening up of activity. Late March, early April, spreads were extremely wider than they would have been normally. I quoted most of our private equity clients a spread of somewhere between 300 and 400 basis points, 3 or 4% wider than where we were pricing deals before the pandemic. And then as you got into June and July, that loosening started to occur more, and then you saw spreads narrowing much more dramatically. There is a little bit of a caveat, though, that as you looked into August, we saw another kind of, albeit slight, a slowdown. And that could be due to the uptick in activity as it relates to COVID, but also just kind of the summer slowdown in general. And then moving into Q3 a little bit further, kind of today, we're still continuing to see a narrowing in spreads. Pricing has come down significantly, both deal valuations as well as credit yields. Post Labor Day, M&A activity has increased significantly. We're very busy right now looking at new stuff. So I do see a continued kind of return to normal as we get further and further deep into, or at least coming out of the quarantine. Last thing I'll say as it relates to timing is there was significantly a bifurcation, however, in the market. On the lower middle market side or the lower market side, call it less than 20 million of EBITDA. Those deals are still probably a little bit more challenged in getting done. But I have seen in the middle market, call it 20, 25 million of EBITDA on up to 100 million of EBITDA or so, that, deal activity is back and those deals are getting through the capital markets with much more ease. And finally, I'll say, Sri, to answer your question on just prognosticating into Q4, I do think that we'll continue to see continued resurgence in the market. Deal activity seems to be robust across the board, including healthcare. There are a couple of factors, though, that we'll take into account as it relates to that, though, especially, first, returning to work. As companies like ours, BlackRock is considering a return to work, and our office in London is actually back. New York is returning. Our Atlanta office will be a little bit behind that. So that will play a significant role. And then obviously the COVID-19 vaccine, and to the extent that comes to market relatively soon, I do think that it will have an effect on deal activity going forward.
Thanks, Kenneth. We were joined by Ben Scruggs, who just joined our panel here. Ben, would you mind giving a quick introduction of yourself as well as our first question here, which is really how has COVID impacted your world, how you think about deploying capital, and any sort of perspectives on the near future of how that might change?
Sure. Hi, everyone. I'm Ben Scruggs. Apologies for the technical difficulties, but thanks to the great tech support here for getting me on. I'm an associate at Hatteras Venture Partners in Durham, North Carolina. We're early stage investors. We focus on all aspects of healthcare. The majority of what we do is in the therapeutic space, but the rest is a mix of med devices, diagnostics, and healthcare IT. Our sweet spot is investing in Series A investments, really trying to get companies off the ground. Often that's coming out of academia. We work with a number of universities, with Duke and UNC in our backyard. We do a lot of deals out of there, but we've worked particularly on the East Coast with Georgia Tech, Emory, Hopkins, and Yale as some examples. We have been around since 2000, currently investing out of our sixth fund. We have around 600 million total under management. As for me, I'm a research scientist by training. I did a PhD in cell biology and a postdoc in genomics. Been on the team at Hatteras since 2016, primarily focused on our therapeutics efforts. And Tree, to address your question about COVID, I would say largely our investment thesis has not changed. We remain steadfast in trying to approach early stage investments, really staying focused on being some of the first money into companies. But I think the way that we have approached that during COVID has changed in some ways. First of all, the way that we would approach, say, a Series A deal has been trying to take a bit of a more mitigated, risk mitigated approach. So the amount of capital that we may allocate to a deal would stay largely the same, but the amount that we might put in initially might be a little bit lower, just to help make sure that we can protect from the unknowns at this point, to make sure that we're properly reserved to help these companies. That's always been our approach, to help companies through the long haul. But if there should be any unknowns here in the future, that we can help protect those companies as we go forward. I think the other aspect for us is that a portion of our portfolio has been dedicated to later stage, more clinical stage co-investment opportunities is the way that we look at that. And during COVID, that's been part of what we have focused on. I think we've all seen really robust public capital markets. Certainly the IPO market has been really strong and exuberant. I think sort of seeing the trickle down to that, to companies that are more at the clinical stage but still private, those types of opportunities where you have co-investors, where you can help mitigate the risk by working together. We've focused on many of those investments during COVID. And I think at this point, we're starting to see more of an understanding of where things are going to go. So there's certainly been no slowdown in our overall deal flow. So I think coming out of this, the perspective that I would have is the pace of investments has not really changed. And I think that we will continue to see a number of great investment opportunities. I think we've all adjusted at this point to how to do diligence in this type of environment. We've been working remotely, and have been fortunate to be able to continue to work in that environment. So I think things will continue to be business as usual in that sense.
Great, thanks, Ben. And if I just might add a few comments, my experience actually mirrors Kenneth's quite a bit. And once March came around, COVID started to really impact the day-to-day business of our operations and our clients. We started to see a lot of transaction activity at either pencils down, or we were kicking the can down the road, partially because of diligence issues, partially trying to figure out what's the new run rate of these businesses. But more importantly, trying to figure out what is the future going to look like? How is it going to be different post-COVID than the world we were expecting and are living in at that point? And as April and May started to we migrated through those, we got a little more visibility. We were able to look at how other countries are coming out of COVID, like those in China, Australia, New Zealand, and how their vantage point was post-COVID. It began to inform our world. And we started to see a lot more interest in transaction activity, really two sleeves. First is e-commerce, and the second, I just call it care in the home. And I think while those have been themes or trends that have been building for years, they really got a jump start, and they really just sort of brought them forward to today. And that's where we see a lot of transaction activity. Even today, there was a transaction that was announced where KKR was buying 1-800-CONTACTS for $3.1 billion. And the press release talked about how during COVID, they saw a 100% increase in their business. So, and that sort of reflects the e-commerce nature of what we're beginning to see evolve in healthcare. And if someone was to ask me where if I had to place chips down for Q4 for 2021, where we're going to see a lot more activity, it'd be along those two themes, e-commerce and care in the home, and trying to figure out how those trends, which had started well before COVID, are really getting accelerated during this period. I'll stop there, and I'm actually going to migrate to what we thought was our next question, which is as we think about post-COVID, we think about the multiple verticals in healthcare. Where are you thinking there's going to be value accretion? Where are you thinking about your respective business that are going to deploy capital? And on the converse side, where are you thinking there's going to be less capital because of COVID? Where do you think money's going to migrate from as we start to move into a post-COVID environment? And maybe we can go in reverse order this time. Maybe I'll turn to you, Ben, first.
Sure. It's a really interesting question, because while COVID has put the spotlight on healthcare, it's really started to highlight a few areas in particular. There are a couple that I think are worth mentioning here. The first would be the diagnostic space. I think just speaking about that broadly, that's really the importance of that has really come to the forefront. Just recently, we've seen Illumina purchase Grail for multi-billion-dollar deal. And I think that's one example, but in that sense, the idea of something like liquid biopsy is a fundamental shift that's really happened. At the same time, whether or not the diagnostic space will stay in the forefront for the long term is more of a question to me. I think the importance of diagnostics, trying to think what is true clinical utility that needs to be demonstrated for a diagnostic, has not really changed. And so the overall valuation and drive for diagnostics will probably be what it has been in the past. There's another space that's really been highlighted here, which would be infectious disease. Obviously, the importance of that is front of mind for everyone right now. That's been a space that has been really out of favor among investors. A lot of pharma companies have exited that space, and so trying to make investments there has been not very popular, more of a contrarian play if anyone is putting dollars to work in that space right now. I think that may be a space that starts to change for the better. Part of that has to do with new legislation that's in front of Congress at this point. A couple of different bills that could help change the way that reimbursement happens in infectious disease, trying to help make it possible so that doctors don't just put their new drugs on the shelf and save those as a last resort. And that's really been the issue and what disincentivizes investors from getting into the space. I think that could be a landscape change, and could be something that could be a positive benefit out of really having infectious disease come into the forefront here. So I'm optimistic, at least fingers crossed, that anti-infectives could come back into favor as a result of this, and maybe we'll see pharma companies start to reemerge here. Now, I think one thing that's been continuous, I'll at least speak to the therapeutic space, is that oncology has continued to be probably the most heavily invested in area. I don't know that I would say that dollars will really move out of there, but I think that's probably one of the biggest questions is, as you think about reimbursement and what's most cost effective, is a drug that extends life for a few months in the payment model. How does that compare to something like an anti-infective? And I don't mean to compare those head to head, but whether or not oncology stays as forefront as it has been may be something that changes over time.
Great, thanks, Ben, for that perspective. Kenneth, how about you?
Yes, certainly. As we think about the healthcare market overall and where we see specific subsectors that will outperform, I tend to agree with one of the comments you just made, Sri, on the e-commerce side, where for us, healthcare IT is certainly a focus. And when we think about healthcare IT and areas within that subsector that we're most focused in on, it's typically services and software that are making that are for payers to make their process more efficient. So that's certainly a focus of ours. I'd say coupled with that on the healthcare IT side are anything related to electronic healthcare records, EHR space, that are making the process of coding and billing and medical records much more efficient. We're also very bullish on as well. So that's one in the healthcare IT space. The other, and then not too far off from some of the comments that have been made in the diagnostic space, but anything related to drug delivery or drug development, we're certainly also considering an outperformance given where we are in the space. I think the obvious piece is anything related to vaccine, COVID-19 vaccine will have some benefit in this time. But even further than that, any late stage commercial prospect drug, oncology and others, to Ben's point, we're certainly interested in targeting as it relates to drug delivery and anything in CRO or CDMO space. Now, the flip side of that, as we think about maybe subsectors that we'll tend to stay away from, at least in the near term, the first is outpatient or physician practice spaces. That has been particularly challenged in this environment. Volumes have decreased dramatically, and in some modalities almost to zero. And although they are a lower cost alternate site, I do think that just given the nature of the business, that they will continue to be challenged until we're kind of in the clear as it relates to COVID-19. And coupled with that, also anything more elective surgery procedures, higher costing will continue to be challenged, and so we're typically probably not making an investment in that sector right now. And then finally, and I think I mentioned this last year on the panel as well. Post-acute, we continue to stay away from. The comment was made about at-home care. I think that's the exception to the rule as it relates to post-acute right now, given the lower cost setting. But we just feel like the post-acute world is under severe reimbursement risk going forward, and will continue to, at least for the near term. So we're staying away.
Great. Thank you, Kenneth. And how about you, Tim, from your experience?
Yeah, I think healthcare being so under-digitized and so inefficient, there's so much waste, and so opportunities around digital health. And I'm not just speaking in sometimes people orient digital health towards a B2C model, but I'm really thinking more of the B2B models where you're helping physicians to automate workflows and just streamline processes. I think that will continue to be a big area. I think there's a lot of work that's happening in transparency. So helping consumers or patients understand both, whether it's the quality of the physicians or where to interact with or how much something's going to cost. I think there's going to be a lot of focus on that. And I am bullish on the alternative payment model. And I think CMS has done actually a pretty remarkable job in sort of these turbulent times of opening up the aperture to for different providers and clinicians to work on different models of payment, which is causing some innovation in the space. And so, that's where I'm inclined to say things are going. Anything that really helps, bend the cost curve in healthcare and really attack some of the areas of waste. And then I'd agree with what Kenneth was saying in terms of, a lot of the post-acute or some of the inpatient or, clinical settings. But I do think that it's going to be a mixture of, people are going to have both the physical and marrying it to the digital world. And I think that's one of the things that COVID's really been able to kind of help kickstart, so that both strategies are being incorporated.
Great. Thank you, Tim. And if I just might add a few comments to that, as we think about it from my world, and I think about where we've seen less value or less capital investment going, it's to your point, Tim and Kenneth, around the physical world, hospitals, post-acute, the urgent care, places where the contact with a physician or a nurse practitioner, we tend to see less money is going towards those, because we believe more and more that the virtual world or the e-commerce world or something that affects how care is going to be effectuated moving forward. It doesn't mean monies aren't going there, but we're seeing valuations drop. And you can see that in how the public markets are valuing the publicly traded hospital companies, the post-acute care companies, or even the lack of trade action amongst the privately held healthcare services companies, whether they be urgent care or physician groups. And I think that's probably a trend that's going to carry forward moving forward. as we think about where monies are going to go, I think the market has clearly tipped its hand over the past couple of weeks, but where they think healthcare service is going to be in a post-COVID environment. Tim, you talked about transparency, which I think is spot on. GoodRx actually went public yesterday, after traded up 40%, clearly highlighted how the market believes, to your point, Tim, that transparency is going to become an increasing trend. CMS is promoting it. Employers want it, and consumers want it, and the market's valuing that. There's a lot of growth there to happen. Within the e-commerce space, we've seen a number of transactions this year reflecting this. Amwell went public a couple of weeks ago. We saw One Health. We've seen other large physician commerce companies try to go public, but they're not like the physician groups where we all got to go see our physicians. They're all virtual care being delivered. And they have different models, both from a transparency perspective and a reimbursement perspective, that they're going out there to try to catch the next patient so that they don't actually have to go in, but they're leveraging technology to get their care. And then when we think about care in the home again, it's around home care. Part of it's telemedicine, but we're seeing the market value home care very different than it has before. We're seeing a lot of the insurers want to gobble up home care businesses because it allows them to control the patient, keep them out of the hospital setting, which is costly, and probably keep them in a more infectious disease controlled setting, given we're in a post-COVID environment. We're seeing the hospital businesses also want to migrate there as well. So I think those are sort of the place way to think about where capital is going to be going from my perspective, or places I'd suggest we're going to see a lot more activity from in the near future. With that, one other thing that I'd like to highlight is COVID has brought to bear the challenges of access to care, as well as the disparities of healthcare amongst different groups in the population, whether they be racial minorities, whether they be the elderly, and would love to hear from your perspective how that all might change, or how you see that beginning to change amongst the companies you cover. Maybe Kenneth, I'll start with you this time, if that's okay.
Yeah, certainly. I think it's a very important topic, and thanks for broaching it as part of this panel, Sri. I think I commend you for doing that. There was a recent Harvard Business Review study that gave a couple of stats that I'll present today. Underrepresented communities, namely African American, Native American, and Latinx communities, are 5 times more likely to be hospitalized as a result of COVID-19 than their white counterparts. Even more specifically, this is also from the article, the African American population is 10 times more likely to die as a result of complications from the virus. So those are pretty compelling. And unfortunately, we've seen this play out with other diseases as well here in the US and globally. So we need to begin thinking about how we can combat this, frankly. And the way I think about it is kind of a 3-pronged approach. This is Kenneth talking, but I'll also give you some BlackRock thoughts at the end of my comments here today. And when we think about it, there's 3 areas that I'll touch on. It's healthcare, there's education, and then there's economic empowerment. So if we just, given the conversation, let's preclude healthcare, because the other 2 I think affect healthcare, so I want to focus on those. But let's preclude healthcare, just given it's become a government issue. There's a lot of controversies around that. I don't think it's appropriate for the discussion today. But let's start with education. I think that Atlanta is uniquely positioned to tackle this very issue. So here we have the CDC, we have top education institutions here in Emory, Morehouse School of Medicine, Georgia Tech, several others. We also have the Grady healthcare system, which is dealing with these challenges as well. And I think it would be very important for all of these institutions and these organizations to begin to, and many of them already have, by the way, to implement programs designed to engage and to identify opportunities for underrepresented minorities specifically, to be educated as it relates to healthcare, because oftentimes many of them are not. So that's the first. The other piece is economic empowerment, which I think is extremely critical and important for this issue as well. And that's where companies like ours and companies like BlackRock can play a role. I do think that overall the private and public partnerships is really the key here. So I will say, and I'll give a shout out to the new Atlanta BlackRock Innovation Hub, affectionately known as our iHub. We have about 300 employees to date, with the goal to grow to 1,000 employees by the end of 2021. But we just put forth an initiative and a task force designed to tackle the very issue of economic empowerment. And so we've recently given financially, as well as through volunteer efforts, to various organizations here in Atlanta. 3 I'll highlight today, which are the Ensoro Education Foundation, the Latin American Association, and then the Partnership for Southern Equity. We've given both financially and through volunteer efforts to these organizations since the pandemic, and we'll continue to going forward, because we think that, you know, putting your money where your mouth is, so to speak, is in engaging in these public to private partnerships are the best way to combat some of these disparities in society in general, but also in healthcare. And I'll pause.
Great, thank you. Tim, how about you?
Yeah, you know, it's interesting. And as we've explored healthcare, one of the things that's always been intriguing are populations that are at risk, right? Because there's so much need and there's a lot of opportunity, and not a lot of folks have been flocking towards that area. It's funny, we were at JP Morgan earlier this year, which seems like a lifetime ago, and in the middle of the conference there was the HT4M, which is the Health Tech for Medicaid conference, and it was really funny, right? Like JP Morgan's in this like swank building, and then like 5 or 6 blocks over in a community center you have, you know, another population of folks that are trying to figure out, hey, how do you create the technologies and the solutions that are going to engage parts of the population that just haven't really been served to. And by the way, typically once you start talking digital, you've already created a divide, because, you know, whether it's education or economics, what Kenneth was just relying on, it's really hard to actually reach out and make contact to this population. So you have to be really thoughtful. And there's a company that we saw called Consejo Sano, which a guy, Abner Mason, is the CEO. And their whole mission is they're recognizing how the demographics are shifting in the US, but primarily our healthcare system is not recognizing those shifts, right? So it's not changing to the cultures and the shifting demographics. And so they're figuring out ways to actually better interact, connect with various cultures within our society that are, quite frankly, sort of left in the dark. Like, this is not an easy topic. I'm interested in the entrepreneurs that are reaching out and trying to come up with creative solutions to really help, you know, this area of the population. And so, you know, it's something that we're monitoring, but if we don't take an active approach, especially in some of our community health efforts, then we're going to have just an even greater divide, and that is not good for any of us.
Great, thank you, Tim. And how about Ben? What perspective do you have on this?
Sure. I think these guys have covered it well, but from the seat where I sit, part of this has to do with clinical trials and how populations are actually represented across those trials. And I think there's a growing access and being able to digitize better representation across clinical trials. As Kenneth, I think, pointed out or touched on at least earlier, the role of CROs here is a really interesting aspect, and the ability to expand infrastructure here to expand clinical trials to a broader patient population, I think, is really going to help generate the data in clinical trials, so you have something that's more real world. And as we start to really appreciate what real world data looks like in terms of drug testing, I think that's going to be critically important. One other aspect of this that we have invested in is end of life care. So thinking through the complications, the difficulty for families to understand serious illnesses at end of life is something that we've tried to think about as a place that could be improved. And so being able to help communicate to families how to deal with serious illnesses where they might not already have access to more information from physicians is a place that we've touched on. So these are areas that we've been thinking about as well, and starting to try to expand where our capital is going to work. But I think these guys have touched on most of the points already.
Yeah. I'll just highlight a few things just from real client experiences. A lot of the clients I cover are the big not-for-profit health systems across the country, from Kaiser in the West Coast to Emory here in Atlanta. And after the JP Morgan conference 2019, where social determinants of health really became a theme, and it was a theme that carried forward for much of 2019, they all really thought about their mission and their purpose differently. And they started to do what, Kenneth touched on, the theme of public-private partnerships. And I could say in the past couple of weeks, the number of conversations I've been part of or have heard about between health systems, insurers, health systems and not-for-profits that deal with veterans who've suffered through COVID, not-for-profits that have dealt with the Hispanic population that have suffered through COVID have really accelerated. And underlying that current has been innovators, tech innovators, young folks who have different ideas and different perspectives on how to access care, either in the physical setting, how do we bring the care to them, or via a virtual mode, which is what, one of the themes we've been talking about before. So I think we're going to see sort of that future aspects about how healthcare is going to be delivered, brought forward, but it's going to have to be triaged down to different populations because each population accesses care differently. And during COVID, we created sort of this monolithic approach to how care should be accessed. It was via telemedicine or you present yourself in your ER. That was really your two modes to approach. But as we come out of this, I think we're going to see a lot more triaging of how care is approached for different populations. And that's going to come from innovation, public-private partnerships, the government committing capital to help these populations that were underserved during this health crisis, and as well as the insurers. While we think about the insurers as being those who tend to provide care and access to care for those that have commercial insurance, they have deep pockets, and for them, there's a long-term economic incentive to get this population's access to healthcare, get them on employer roles, because ultimately they can be part of that membership population they serve. So there's multiple ways. You're starting to see that all get galvanized right now on how we move forward. With our last 5 minutes, I'm going to ask each of us to give sort of a quick 1 minute answer to sort of what keeps you and your clients up at night, the companies you cover. What keeps them really nervous about the future as they look forward to healthcare over the next 5-10 years? So I'll start with you, Ben.
Sure. So I think I have a couple of perspectives. One is a more near term as opposed to the 5 to 10 year. And I think in the near term, the effect of COVID on clinical trial sites has had a dramatic impact on enrollment, and can you deploy capital appropriately and have that go to use? I think we've seen various rollouts and how clinical trial sites can come back online. Various parts of the country that's come back online quickly. In other places, it's taken much longer. But I think it's gone well to be able to keep important trials running, and that's something that all our companies have had to deal with. I think in the more long-term play, aspects that would keep us up at night are really trying to think through some of these intersection pieces of pricing in particular, and in the way that we think through new novel technologies, things like gene therapy that enable great revolutionary therapeutics, but the pricing dynamics are a challenge. And so trying to think through what's the right way to do that, what's the right way to deploy capital into those companies for the right patient population is something that we wrestle with constantly and try to continue to understand. I'm really bullish and excited about what these new modalities could do, but at the same time, we have to get the pricing models right for that.
Thank you, Ben. How about you, Kenneth?
I'll be brief. It is very much stroke of the pen risk. I think given where we are administratively and what could potentially happen in November, folks are a little bit on the sidelines, kind of waiting to see what the next administration will be, who will be, and frankly, what effect it will have on reimbursement specifically as it relates to a lot of the subsectors we mentioned before. So all of the discussion we've had already about kind of where reimbursement sits with various subsectors, as my lawn guy walks past, could go out the window as a result of kind of where we stand politically, and so that's an important topic.
Thank you, Kenneth. How about you, Tim?
Yeah, it's also regulation. I think, look, we've had a lot of innovation with allowing alternative payment models. We need to let that continue to stand. Honestly, I didn't expect this administration to be as open, continuing the work on alternative payment models. I think as long as we don't go, for a Medicare for all scenario, I think like a Medicare Advantage for all is like maybe a good thing, but I think sometimes the way we talk about it in such extremes without realizing the intricacies and the alignment that you need behind everyone within the ecosystem. Those are the things that concern me the most, because ultimately we just need to get better care and better access and better quality for everyone within the industry.
I'll just add one more comment to that, which is it really dovetailing off what Tim and Kenneth were saying. The regulatory and legislative environment impact this so much, but at the end of the day, it's the ability to execute. Do the teams out there have the resources, the capital, the skills to execute whatever opportunities sit before them? And in a wavering legislative environment, governmental environment, and regulatory environment, when you have a great plan, you're ready to execute, and the rug gets pulled up underneath you, whether it be from any of those three dimensions, it's really hard to think about how do you plan for the future. So all you can do is plan for day by day. And I think to Kenneth's point, we need a long run visibility on what the future regulatory environmental environment's going to look like. And that gives us the ability to plan for all the issues that we talked about before. So I'll stop there to see if any of my panelists have anything else to add as we round out our time. Great. If not, thank you for joining us this afternoon. If you have questions, please reach out to us directly. We're happy to engage with any of you about any of the topics we discussed, and enjoy the rest of the conference. Thank you.